Hi, my name is Sulema Vasquez, and this is my medical terminology media showcase presentation. I chose epilepsy as my medical topic to discuss for a couple of reasons. Having been in the medical field for close to 20 years, I've seen firsthand what it's like to encounter a seizure, someone having an active seizure, someone about to have a seizure, and what it's like to see a person come out of a seizure. I was also in home care and took care of a person who was epileptic and had to give her medication, had to walk her through her seizures. Throughout growing up, I had a really good friend whose mother was epileptic, and I saw how that affected their life. And also, I had the opportunity to interview someone very close to me that also is epileptic and has different forms of seizures. And that interview will be at the end. I'm sorry I don't have all the bells and whistles, but I really feel that this topic is something that is serious and needs awareness to be brought to it so that it can be more known and have the attention that it deserves. Epilepsy has been stigmatized as something to be hidden, to be embarrassed of throughout history, but we do know that this is a sickness that affects any and everybody and has various causes, and not necessarily something that you are born with. It could be caused by many things, and I will go into that shortly here. So there are different types of seizures. There's focal, there's generalized, there's a combination of focal and generalized. According to our textbook, the terms are tonic-clonic, which is a grand mal, more of a whole body, where the body becomes rigid, and there's uncontrolled jerks. Then there's petit mal, which is a loss of awareness, also known as a staring episode, where a patient will just stare off and not know or not be conscious of what's going on around them, or possibly be aware of what's going on around. There's so many different types of symptoms that this is why this is very interesting, because there's really no white or black with this condition. So we do know this is a neurological disease, something to do with the brain, that basically there's an abnormality of brain function at this point. Too much or not the right kind of brain function, to put it in layman's terms. It's just an unknown inability to function normally, electrical activity. So the population that's affected by this is another interesting point, is that everybody and anybody can be affected by this disease. The most current statistics that I found online, according to healthline.com, stated that 65 million people are affected by epilepsy in the world. And they use the term people because, again, this is anyone's a candidate for this condition. And according to the National Health Service and the Mayo Clinic, the causes can range from genetics, prenatal injury, an injury at birth, brain tumor, brain infection, severe head injury, drug or alcohol, substance abuse, or stroke. When it comes to signs or symptoms, UCSF is pretty much at the top of the line, has the highest ratings of all the studies that they've done. They've been ranked the highest by the National Association of Epilepsy Centers, so they are basically the go-to for the information, which is another resource of mine. There's many types of seizures, but what you can look for in somebody is loss of ability to control themselves, their body, jerking, twitching, like I mentioned before, inability to speak, loss of bladder control, sudden loss of consciousness is also a very big one. And because the treatment has to be tailored to each individual person because of the range of symptoms, there is no one type of treatment. It's not just take this pill and this is going to go away forever. This is something that's going to be treated throughout their entire life. And it can go from medication that they take daily to a lobectomy, where they're getting a piece of, technically, a part of their brain will be removed. We can live with part of our brain being gone, having been removed, which would be, the term is for that is lobectomy. They would figure out with tests which part of the brain needs to be removed, or which part is having the abnormal electrical activity, and that's how they would determine what to extract. And this is something, like I said, that's not the same. The treatment is not the same for every patient. It is so different, which is another reason why epilepsy is such an interesting topic. I also wanted to end with the fact that of the people who have epilepsy in the world, 70% of them could live with their seizures controlled if they had the proper care. But that's not the case in our world, unfortunately, whether it's living in a third world country or just not having the ability to be diagnosed properly. Many people are enduring this condition and not having the proper care for it. And people with epilepsy are have 3 times of a higher risk of having a natural death than people who do not have epilepsy. So basically, because of this condition, there's a higher risk of these people dying. So again, like I said, I chose this topic because it's something that's not only very interesting, it reaches anybody and everybody on the planet. And it doesn't matter your social class, it doesn't matter your race, it doesn't matter your gender. Epilepsy is something that can reach everyone, and maybe everyone knows somebody who has this condition. And I just wanted to raise awareness to it. And following is an interview of someone who has dealt with epilepsy since childhood. So thank you for your time, and I hope that this was not too boring and informational. Okay, so thank you for doing this interview. This is Isela, and she's going to tell us a little bit about her life and having seizures. So I'm going to ask you a few questions here. I'm just going to start. What age did you experience your first seizure?
I was 13 years old when I had my first seizure. I remember walking into the restroom and my sister helping me change, and that's when I had my full-blown seizure where I passed out in the restroom.
Okay. And do you have just one type of seizure where you pass out, or do you have the different types of seizures?
I have different types of seizures. Sometimes I don't pass out, but I am having like a convulsion, like twitches, but I'm aware of my surroundings. And then I have another type of seizure where it starts off the same way, but then I lose consciousness, and at that point I don't realize what happened.
And can you do your best just to kind of briefly describe what it feels like when you're having the seizure, when you're about to have it?
When I'm about to have a full-blown seizure, what I call the big seizures, then I know that it starts off, like I said, twitching, and then when I'm going to have the seizure, I feel like I lose control of my arms. That's what starts off, like I have no control of my arms, and not even of my words. I can't even talk. And then I feel like I'm falling into this big, deep black hole.
And when you're coming to, like when you come to, how is it when you're back, and like for the rest of the day, how do you feel?
So when I come back, I can hear people around me. I can hear people talking. I realized that I had a seizure because I can't even move my mouth to talk or my body. That's how I know I had a seizure. And the rest of the day, I feel very sore. Like if I worked out, my whole body hurts. I feel like my brain feels like I can't think clear. I feel a little sad, disappointed.
Okay, thank you for sharing that. And um, how what would you like people to know, or what would you like to bring awareness to in regards to seizures?
Definitely, a person that has seizures needs to live their life very peaceful, as calm as possible, not stress out. So, don't stress them out. Don't make their life difficult, because anytime a person has stress, someone who has seizures, it can trigger seizures if they feel very depressed, sad. So negative emotions have a big impact on a person if they're going to have seizures.
Okay, I want to thank you for putting yourself out there like this, and I appreciate your time, and thank you for letting me ask you this question.